Imagine this. You're going about your day when suddenly you see someone collapse. A child starts choking at a nearby table. A cyclist wipes out right in front of you. Scary, right? These situations are more common than you think, and knowing what to do can be the difference between life and death. Did you know that millions of lives are lost every year because people nearby didn't know basic first aid? That's why I'm here. You don't need a medical degree to be a hero. Today, I'm going to teach you 5 essential first aid skills that everyone should know. We're talking simple, actionable steps that can empower you to take control in an emergency and potentially save a life. We're going to cover everything from CPR and the Heimlich maneuver to treating burns and recognizing the signs of a stroke. Trust me, these skills are much easier to learn than you think, and they stay with you for life. So let's dive in and get you ready to be someone's hero. Alright, let's start with a big one, CPR. This is a life-saving technique that can literally restart a heart. Now, I know this might seem intimidating, but trust me, it's easier than you think. The first thing you want to do is check for responsiveness. Gently tap the person's shoulder and ask loudly, "Are you okay?" If they don't respond, it's time to call for help. Yell for someone nearby to call 911 immediately and to find an AED or automated external defibrillator if one is available. Next up, we start compressions. Place one hand on top of the other, interlacing your fingers, and position them in the center of the chest, right between the nipples. Now here's the key, push hard and fast. You want your compressions to be about 2 inches deep and at a rate of 100 to 120 beats per minute. Think of the beat of the song, Stayin' Alive. It's a good rhythm to remember. Keep those compressions going until help arrives or an AED is ready to be used. If an AED is available, turn it on and follow the voice prompts. These devices are designed to be user-friendly, and they will guide you through the entire process. Now you might be thinking, can I really do this? Can I really save a life? The answer is a resounding yes. In fact, in 2021, a 12-year-old girl saved her dad's life using CPR that she learned on YouTube. You have the power to do the same. Let's move on to another potentially life-saving skill, the Heimlich maneuver. Choking is a terrifying experience, both for the person choking and those around them. It can happen so quickly, and it's crucial to act fast. If you see someone choking, the first step is to ask them if they are choking. If they can speak or cough forcefully, then they are getting some air, and you should encourage them to cough it out. But if they can't speak, are turning blue, or are clutching their throat, it's time to step in. For adults and children, stand behind them and wrap your arms around their waist. Make a fist with one hand and place it slightly above their navel, with your thumb facing inwards. Grasp your fist with your other hand and give a quick, upward thrust into their abdomen. Repeat these thrusts until the object is dislodged or until help arrives. Now for infants, the technique is a bit different. Lay the baby face down on your forearm, supporting their head and neck, and deliver 5 firm back blows between their shoulder blades. Then, carefully flip the baby over and give 5 chest thrusts, using 2 fingers placed on the center of the chest just below the nipple line. Remember, never slap a choking person's back. This can actually push the blockage further down the airway, making the situation worse. The Heimlich maneuver is designed to create a forceful expulsion of air, dislodging the object and allowing the person to breathe again. Now let's talk about severe bleeding. It's a scary sight, but knowing how to control it can make a world of difference. You see, uncontrolled bleeding can be fatal within minutes, so it's crucial to act quickly and effectively. The first step is to apply direct pressure to the wound. Find a clean cloth. It doesn't have to be sterile, just clean, and press firmly on the bleeding area. Apply constant direct pressure for at least 5 minutes. Don't be tempted to lift the cloth to check if the bleeding has stopped, as this can actually disrupt the clotting process. If possible, elevate the injured limb above the heart. This helps to slow down the blood flow to the area. For example, if the bleeding is on the arm, have the person lie down and elevate their arm above their head. If the bleeding is severe and direct pressure isn't working, you may need to apply a tourniquet. A tourniquet is a tight band that is placed a few inches above the wound to restrict blood flow. It's important to use a proper tourniquet if you have one. But in an emergency, you can improvise with a belt, scarf, or even a piece of cloth. Now, I know tourniquets might seem scary, but trust me, they are life-saving tools. They are not just for soldiers on the battlefield, they are becoming increasingly common in first aid kits everywhere. If you need to apply a tourniquet, place it about 2 inches above the wound and tighten it until the bleeding stops. Burns are another common injury that can range from mild to life-threatening. Knowing how to treat them properly can prevent infection and minimize scarring. The first thing to do is cool the burn. Run cool, not icy water over the affected area for at least 10 minutes. This helps to soothe the pain and reduce swelling. After cooling the burn, cover it with a sterile, non-stick bandage. This helps to protect the area from infection. Now let's talk about some common burn myths. Contrary to popular belief, you should never apply butter, ice, or any greasy substances to a burn. These can actually trap heat and make the burn worse. Similarly, avoid popping any blisters that may form. Blisters are the body's natural way of protecting the injured skin, and breaking them can increase the risk of infection. I remember a case in Florida where a mom saved her toddler's hand by avoiding these common burn myths. She immediately cooled the burn with cool water and rushed her child to the hospital where they received proper medical attention. Remember, when it comes to burns, simple is best. Cool, cover, and seek medical attention if necessary. Now let's move on to two serious medical emergencies: stroke and shock. Recognizing the signs of these conditions and acting quickly can mean the difference between life and death. Let's start with stroke. A stroke occurs when blood flow to the brain is interrupted, and it's a time-sensitive emergency. The faster you recognize the signs of a stroke and seek medical attention, the better the outcome for the patient. A good way to remember the signs of a stroke is to use the acronym FAST, F-A-S-T. F stands for facial drooping. Is one side of the face drooping or numb? A stands for arm weakness. Is one arm weak or numb? S stands for speech difficulty. Is the person having trouble speaking or understanding speech? And finally, T stands for time to call 911. If you notice any of these signs, even if they are subtle or temporary, call 911 immediately. Every minute counts when it comes to stroke treatment. Now let's talk about shock. Shock is a life-threatening condition that occurs when the body is not getting enough blood flow to its organs. It can be caused by a variety of factors, including severe bleeding, allergic reactions, and infections. The signs of shock can vary depending on the cause, but some common symptoms include pale or clammy skin, rapid breathing, a weak pulse, confusion, and loss of consciousness. If you suspect someone is in shock, call 911 immediately and then take the following steps. Lay the person down and elevate their legs about 12 inches. Keep them warm and comfortable. Do not give them anything to eat or drink, as this could cause them to choke if their condition worsens. I once heard a story from a stroke survivor who said her coworker saved her life because she knew the FAST acronym. She noticed her coworker's facial drooping during a meeting and immediately called 911. Because of her quick thinking and knowledge of stroke symptoms, her coworker made a full recovery. And there you have it. 5 life-saving first aid skills that everyone should know. Remember, these skills aren't about memorizing complex medical procedures, they're about empowering yourself to take action in an emergency. It's about knowing that you have the potential to be someone's hero, to make a real difference in a life or death situation. To help you remember everything we've covered today, we've created a free, downloadable first aid cheat sheet. You can find it in the description below. Download it, print it out, and keep it handy. You never know when you might need it. And hey, why not practice these skills with your friends and family? Make it a fun learning experience. Don't forget to subscribe to the channel and hit that notification bell so you don't miss out on our upcoming videos. We'll be diving deeper into more advanced first aid skills like managing seizures and allergic reactions. Until then, stay safe, stay prepared, and remember, in an emergency, doing something is always better than doing nothing. You've got this. Host. These skills take minutes to learn but last a lifetime. Download our free first aid cheat sheet below and practice with friends or family. Subscribe and hit the bell. We're breaking down advanced skills like seizures and allergic reactions next. Remember, in an emergency, doing something is better than doing nothing. You've got this. Stay safe, stay ready.